When people think about ultrasound, they picture a large machine sitting in a hospital imaging department. They think of long wait times, expensive equipment, and needing a specialist just to get any answers. But healthcare is changing quickly, and one of the biggest shifts happening right now is the rise of point-of-care ultrasound, also known as POCUS. POCUS is exactly what it sounds like: ultrasound imaging performed directly at the point of care. Instead of sending a patient somewhere else for imaging, clinicians can perform an ultrasound exam right in front of the patient during the appointment. They can perform it at the bedside, in the emergency room, on the sideline of sporting events, or even in a remote and rural setting. It gives healthcare providers immediate visual information that helps them make faster, more informed decisions. And that speed matters. One of the biggest problems in healthcare today is delayed diagnosis. A patient comes in with pain, swelling, shortness of breath, or another concerning symptom, and that process often turns into multiple appointments, referrals, imaging orders, and waiting days or even weeks for answers. That delay can impact outcomes, increase healthcare costs, and create frustration for both patients and providers. This is where POCUS changes the game. Instead of relying only on physical examination or waiting for traditional imaging, clinicians can use portable ultrasound technology to immediately look inside the body in real time. A physician can quickly assess fluid in the lungs, evaluate muscle or tendon injuries, examine joints, guide injections, confirm pregnancies, assess bladder retention, evaluate cardiac function, and much, much more, all within minutes. POCUS is becoming increasingly valuable across nearly every healthcare specialty. In emergency medicine, it helps clinicians rapidly assess trauma patients in life-threatening conditions. In sports medicine or orthopedics, providers can evaluate soft tissue injuries on the spot. In family medicine and primary care, physicians can add another layer of diagnostic confidence during routine visits. In OB/GYN, providers can quickly assess fetal positioning or pelvic concerns. EMS teams can even begin to integrate portable ultrasound into pre-hospital care. The reason this movement is growing so quickly is simple. Clinicians want faster answers, better workflow efficiency, and more accessible imaging. But historically, there's been a major barrier. Traditional ultrasound systems can be bulky, expensive, difficult to transport, and often require multiple probes for different exams. That creates limitations for smaller clinics, mobile healthcare providers, athletic trainers, rural healthcare settings, and practices trying to expand without adding massive overhead costs. And that's where Vave Health comes into the equation. Vave Health developed the Universal Probe, a fully wireless handheld ultrasound device designed to simplify and modernize point-of-care imaging. Instead of needing several separate probes for different applications, the Universal Probe combines multiple imaging capabilities into a single device. That means providers can perform more cardiac, abdominal, vascular, MSK, lung, OB/GYN, and superficial imaging, all from one probe. And because it's fully wireless, clinicians aren't tied down by cords, carts, or complicated setups. The probe connects directly to a smartphone or tablet, creating a portable imaging solution that can move wherever care happens. That portability is one of the biggest reasons POCUS adoption is accelerating at a rapid rate. Healthcare providers today need flexibility. Sports medicine physicians may move between clinic rooms and training facilities. An EMS provider may need imaging in the field. A physician assistant in a rural clinic may not have access to full imaging departments. Portable ultrasound allows providers to bring diagnostic capabilities directly to the patient instead of forcing the patient through a slower system. Another major advantage of POCUS is patient engagement. When a patient can actually see what providers are looking at in real time, it changes the conversation. Instead of simply hearing an explanation, they become part of the diagnostic process. Providers can walk patients through injuries, inflammation, fluid buildup, or anatomy directly on the screen. That visual communication often improves understanding, trust, and confidence in treatment plans. And importantly, POCUS is not meant to replace every traditional imaging modality. There will always be situations that require comprehensive imaging studies, radiology departments, CT scans, or MRIs. But POCUS fills a critical gap between physical examination and advanced imaging by giving providers immediate clinical insight. That's why many healthcare professionals now view ultrasound as the modern stethoscope. The difference is that the stethoscope allows you to hear what's happening inside the body. Ultrasound allows you to actually see it. As technology continues to improve, handheld ultrasound devices are becoming smaller, smarter, and more accessible. What used to require an expensive dedicated imaging suite can now fit in a provider's pocket. That shift has the potential to improve access to care worldwide, especially in underserved communities where traditional imaging infrastructures may not exist. Ultimately, point-of-care ultrasound is about speed, accessibility, and better clinical decision-making. It empowers providers to evaluate patients in real time, increases efficiency, and helps deliver faster answers when they matter most. And companies like Vave Health are helping drive that transformation forward with solutions like the Universal Probe, making high-quality portable ultrasound more practical, more versatile, and more accessible for modern healthcare providers. If you would like to learn more about the Vave Universal Probe, you can visit our website at vavehealth.com or click the link in the description.